Okay, thank you, Mr. Chair, Mr. Speaker, rather, for giving me this opportunity to join with Dr. Westford to give you a wider overview what the budget is intended to do. As a matter of fact, her contribution was so powerful that I think mine will be easier to complete, and we'll get to let you off home early tonight. Now, first of all, let me thank the team that prepared this budget. And why I'm doing that, sometimes or many times the persons looking at it, the Guyanese citizens, do not appreciate the amount of hard work that Dr. Ashley Singh and his team, some of them are here. But as I usually like to say, good things come wrapped in small packages. And I'm referring to the budget. I'm referring to the budget. So thank you, Dr. Singh, on behalf of Guyana, and especially persons working at certain levels. Now it's an early budget, and I don't think any speaker before me brought that to your attention. But I want to bring it to your attention to again congratulate the team, and let's see, what does it mean? I'll speak to an early budget, which has no new taxes. Congratulations, Minister. And at the same time, it's transformational. Three major points I want to develop. Early, what it means? It means that when the funds are officially budgeted and passed through a certain legal process, the REOs and the RHOs, regional executive officers across the regions, and the RHOs, regional health officers, and their subordinates will have 12 months almost to deliver 12 months money worth. Usually because it comes about March, or sometimes one year, I think the budget came out on All Fools Day. You remember that? So the timely budget or early budget gives those operatives the time that they need, because we sometimes demand from the REOs and the executors in the field 12 months products when we take away the first 3 months, as is in the past, and they have only 9. So I think that's a point we got to note, and it shows that we're getting our governance structures and manner of managing government better and better all the time. No new taxes. I need not much to talk on that. It's early, no new taxes, and it's transformational. Transformational. It's laying the basis that in future, making us so strong in the health sector and related sectors, that we can build on strong shoulders, stand on strong shoulders in the coming years. For example, we've heard many times from many speakers here that there's 6 new hospitals. That is transformational. Remember, just before the PPPC came into office in 1992-93, we at that stage had inherited a system where they had only 157, I think it was, doctors in this country. And our hospital stock was not expanding, not even in the private sector. And many of those doctors, if not all, or practically all, were based in Georgetown and some such built-up population points in our country, New Amsterdam and so on, Bartica. That has changed with the number of doctors we have now. That was transformational. What this budget does is to build further on that, introducing training of other classes of workers, other groups of workers who need to help their doctors deliver their services better and better in more time, in more places, at more times, and so on, using more technology and more diagnostic skill. So that's good. Thank you for that. The transformation, 6 new hospitals. This is massive. This is massive. And it is predictory, it's transformational. We know that they're going to be oil and gas, people will be coming here, we have to come up to a world standard. But mainly it is for our people who will be enjoying now a wider network of hospitals that are modern, and not only that, well staffed, right? So please note that, Mr. Chair and Mr. Speaker and the wider audience, especially Guyanese out there. Of course, there will be teething problems, and you might have little delays in getting it, but I get from the discussions I'm having and being part of that everything is on track. In other words, Guyana is back on track. Guyana is back on track. Back on track. Thank you, Minister Ashley Kumar Singh, Dr. Ashley Kumar Singh, for being part of the team that is putting us back on even keel. Remember that 5 years, that destructive 5 years? It's like a rotten fruit. Even if you remove it, it leaves a stain. And you're having a good representative of it now, showing how they were. They were indeed rotten. Is that an allowed word, Mr. Speaker? I'm now getting into the real mood now, you know. So training. You must have, if your strategy is to expand in terms of hospitals, the next part of the strategy, the Ministry of Public Service will tell us, is you have to train the adequate personnel in right numbers, including not one shift, you got to cater for 3 shifts, you got to cater for pregnancies, you got to cater for holiday, vacation and so on. So I want to thank Dr. Ashley Kumar Singh for doing that, and I know that the Minister of Public Service now is going to have a heck of a time, lots of work to do, right? So I think she's up to it, you know. Well, Jenny is an advisor there, and that's a good move by this government. What this government did is give the ministers, new ministers, some support by administrators, by advisors. That is a good thing to do. Congratulations to President Erfanali, and of course the Prime Minister who's there, and the Deputy and the Vice President. Training. There's a massive program of training going on for the past few years. And I don't think Guyanese really appreciate the scale. For example, I said when we took over many decades ago, you would have about 30 or 40 nurses in any one program. Now it's massive to such an extent that we had to, and I did this quietly without any fanfare, we had to move out from we had to add to the East Street Nursing School. Everybody talked about nursing training as East Street Nursing School. That's a minuscule amount of people there. So the Kingston Nursing School, many people forget it, right? These were transformational and innovative initiatives. We took it over, it was in good condition and so on, and that was a very good move. Why? We have space now for additional training, not additional training in the day, but in the night too. And I'm happy for the first batches of the night nurses. They stood by me because they were being discouraged. Who is studying in the night? How you can study in the night? They're going to get raped going home. The minibus are going to come here and all kind of thing. But that's, of course, don't the nurses work in the nighttime? Don't the student nurses that they were trying to protect from nighttime duties and nighttime learning, don't they eventually graduate and become qualified nurses who have to work in the nighttime? And some of them having their own kids at home, having their own issues. So I want to thank them for working right throughout the day after coming to the nursing school, giving service while having their own concerns. Congratulations. Congratulations. And I'm certain that Dr. Ashley Kumar Singh, when the wealth from the oil and gas has integrated, we can get a little top smoke. We can think on it. But it is not only money-wise. Dr. Ashley Kumar Singh might agree with me. Money, yes, but put in the training in your brains and from the schools, the nursing schools. So one major thing that this budget does is upgrade the nursing school. Upgrade the nursing school. Of course, staffing was always a little problem, and I think that he's already made arrangements in his budget to get better staff, qualified staff. As a matter of fact, when I was Minister of Health, we started to have doctors and laboratory technicians from the small islands. Big Brother Guyana here. Somebody stole that team copied that name from me. Guyana was being Big Brother, and I was pushing it in the health sector. Having met some of them when we traveled, the leaders of the health sector in the small islands, I came to the conclusion that you could invite some of them here to get the training. Big Brother Guyana, I want to copyright that term, right? And I think that the Minister of Public Service would have known that. I hope that hasn't been scaled back due to the intervention of 5 years mismanagement. But we were being united. Cricket and Calypso is not enough to keep Guyana united with the Caribbean. So we were putting people-to-people contact. Because as you know, and I won't develop this point much beyond at this time, Guyana is now full bore on its continental destiny. That's an aside you might want to think of. What does it mean? We have an influx of people from other countries and so on. How do we do border control? But that's aside. For this discussion, we have to indulge in massive training, which means we sometimes did not have the skills, and we had to import some of it in terms of training to make curricula and so on, Mr. Speaker. So that's one thing I want to say. I have found it in the new budget. They still have little rubrics supporting that, on that continuation of that massive activities. Lots of the work you see happening, a lot of things goes on behind closed doors. Lots of professionals are spending their nights getting together, the program, the training, and so on. So congratulations for being enlightened enough to continue that approach. Health democracy. You know, this word democracy is bantered about so much. I said, let me do it too. Health democracy. We're having systems now in place, Mr. Chair, Mr. Speaker, where not only advanced or developed areas of population points in the country are having resources to of doctors and nurses, but we even have them roving now, looking for patients. Because of the number of doctors we now have, you can send some of them out into the field to identify certain threats, health threats, before they become a threat, prophylactic. And I want to congratulate those doctors for sticking to the guns. Of course, there's some difficult ones that you have to manage sometimes, and the Public Service Ministry was very helpful in keeping them in line. Right? Why? Practically all of them, all of the doctors and other personnel, are on government contracts. They were educated not with their own funds. They took your funds. They were educated as civil servants, and they must give back. So I want to congratulate all the handlers, all the parents, and people who are related to these doctors for their great effort to get those doctors to come back and serve wherever they are sent in Guyana, because they signed such a contract. Okay? And I'm getting the impression that they're doing better and better all the time, in spite of you having a few bad eggs in the bunch, right? Improve diagnostics. I noticed in the budget there's massive increase in spending for imaging. In other words, non-invasive methods of diagnostics. And in such a case, some of the equipment is so sophisticated and the software sold with them that you can link up with centers of excellence overseas and be guided to how diagnostics. It's like magic. It's like the comic books we used to read, you know, when we were kids. You don't read comic books anymore now, right? Okay, but now it's a fact. So that's another good thing that is done. And I noticed that not only equipment is being provided or funds for the equipment, this very specialized equipment, but for training, okay? And this is where another aspect of it comes in, the diaspora. I didn't see indirectly or directly much mention of it in the budget preparation, but that's the next thing we can look and remedy. Lots of the equipment that you'd have, Guyanese doctors overseas, some of them retired or technicians, would have had some knowledge. So we need to reach out a little bit more to get that to get that cohort of Guyanese who want to come back to Guyana. And a Guyana that is blooming, not a Guyana of blackouts, not a Guyana of the organized thievery and so on. So the Guyana is better, and not only will the diaspora be coming back, but we are going to be having, we are laying the foundation for health tourism, whereby people coming in from jurisdictions who are accustomed to better things, modern medicine, if they come in, they will be having access to those 6 hospitals and so on. Of course, they will be made the hospitals mainly for Guyanese, but I get the impression that we will very well be looking for a foreign audience, which can beef up the resources being garnered. Further, because of a massive training of doctors, and listen to it, 1,000 doctors. That was very scale. The PPP think on big scale, not coach, you know, these little small things. If we did not do that, we would not have been able to populate the new hospitals and health centers that we spread right across the country. It was vision. Over the past few years, we built dozens of health centers and hospitals, besides the 6 that are coming up. But hospitals and health centers, the 4 walls of those institutions, don't deliver health services. It's the people who populate them, and the attitude, the work attitude too. So by and large, it's a success story with 2 prongs. The construction of infrastructure, which is going to be continuing with the 6 hospitals, plus there's other smaller ones. You must not forget that. Smaller physical infrastructure. The 6 hospitals new will be eclipsing those. But your government, your party is taking it even further at various levels. I noticed, for example, in other parts of other sections of the economy, they're doing this training, the Gaisuko Training College, which was a kind of one of the best training colleges for such pupils, or such students rather, will be expanded and be made into a college now, a technical college. So the President Ali's government is thinking not only specialized in one area, but also in the productive area, right? That is the Gaisuko School. As a matter of fact, we can put a plug for that. I do know that there are several graduates of that college who are overseas doing well, and their services are sought after. So I think with the more funds from the oil and gas, that institution is about to be upgraded, and I'm certain that the result will be even more qualified persons. The next thing I want to note,
Honorable member, before you move to the next, you'll need an extension.
Mr. Speaker, I'd like to ask that my honorable colleague be given further time to conclude his presentation.
Thank you, Minister Teixeira. Honorable Member Dr. Ramsarran, you have 5 minutes to conclude.
Okay, got it. Maternal health, child health, the vaccination programs. Guyana is on top of the world in this regard, believe it or not. And it is because for the 20, 30 years starting under the PPPC, when Mr. Jagan insisted on this, the vaccination program was being done at the health centers for some 18 or 19 vaccine preventable childhood diseases. That's how we were able to wade into COVID, and we did have deaths, but they were checked with other jurisdictions who didn't have that strong primary health system, and you'll see they did worse, including the United States. That's where you have paid medicine, where you have all the specialists in the world, but in Guyana you have dedicated medicine, free medicine, and what prophylaxis. The nurses would go out there and find the patients who are ill and have them come to the health center. So that we have a good model. The imaging capacity, as I said, is becoming more and more modern. In other words, we'll be having technology in our hospitals, which even some big hospitals overseas will not be having. We'll be having more specialists. That is where education comes in. It goes to health education. More specialists going more places and staying there overnight. It would not happen, but we have measures in place to do that. The vaccination program, as I want to let the nation know, and it's funded in the budget to continue that. We're going for about 20 vaccine preventable childhood diseases. We have at the political level, we have where the chronic diseases take over about 65% of our budget. And those are chronic diseases are things that you don't catch by somebody sneezing on you, but you're born with it, and in the later life you'll get it, like heart condition, diabetes, and so on. We're doing great in that because we are the doctors who are trained overseas, mainly in Cuba and other areas. We have enough of them now to specialize them in small areas, especially in child care, neonatology. A neonate is a child who is up to 28 years. A certain period of time calculated by doctors when they suspect that he still needs to be in the neonatal arrangement. So we have been emphasizing that so that we can start off life from the very smallest level, hale and healthy, and you won't be having chronic diseases in the population after time. So there's better management too of the health centers. We have over 400 health facilities. Many of them are health centers. And what has happened, comrades, colleagues? Because of the massive number of doctors we have at health centers, every health center, practically a doctor, and in some cases more than one. Whereas in the not so distant past, you'd have a medics or a senior nurse. So that's another thing we need to congratulate the Ministry of Finance for allowing, understanding that the health helps build seawalls, health build canals. You know, in some cases when you deal with certain other ministries, they don't think health is so important. They don't realize that we keep the workforce healthy, therefore they're able to use the workforce to make health centers and so on and so on. So it's an integrated approach, and I'm putting a thank you plug with Dr. Ashley Kumar Singh and his team for seeing that even at that level, the health center level, that funds are there and adequate. Maternal health, I mentioned that. The vaccine program I've mentioned, but I would like to come now to the mental health. Mental health is going to be very much integrated. As I pointed out when I was minister, twice I had the Minister of Health. We put it on the agenda for the first time, mental health. So we expanded the NCD, the Non-Communicable Disease Commission, to include mental health. And we've had several indications that this is the way to go, and we've been able to add that on, and training is becoming more and more popular among the young doctors. Initially, mental health and such issues were not so romantic, not so exotic, but now they're understanding, and because of the work we've done among the doctors, they're coming forward now to be specialized in mental health. That's a good thing. The NCD Commission, the Non-Communicable Diseases Commission, that's a very powerful thing where you would have not only medical people involved, but it's a commission including the private sector, and the private sector in terms of the merchants and traders and so on, and the private sector meaning hospitals. So you're having an overview of the entire economy, and you can then make your interventions prophylactically. So, Mr. Speaker, I think though I would like to, I don't want to keep you away from your nightly rest. So I think I close there and say I recommend that this budget be taken on board quickly, and because we have lost the month of January, that we start implementing it forthwith. Thank you, Mr. President, Mr. Speaker.